The four big rankings that we look at in this paper are Consumer Reports, which has a ranking that claims to be of quality, hospital quality. There's also Health Grades, which measures top hospitals, best hospitals. U.S. News and World Report, which claims to do the same. And then the Leapfrog group, which does a more focused ranking of safety. And so those are basically the four big ones that we looked at evaluating. And those are ones that are known to the public in various varieties. Now, what's interesting about those four is they differ pretty systematically in terms of their quote-unquote business model. So that's one thing that's an interesting difference that we're kind of working through and seeing. And part of the reason why we wanted to evaluate them is we wanted to see, does who these organizations are and what comprises their rankings actually have substantive differences, or is the contrast would be, is quality, and they all end up ranking all the same hospitals. What we find actually is they don't. So there's very little, almost zero overlap. And part of that's because of some of the choices that each of these ranking outfits makes. So for example, Health Grades is a for-profit company backed by venture capital financing. So they have a business model that in part is about consulting, right? And how do you get on our top 100 or top 50 list? And they end up ranking actually a very small number of hospitals. So it's that top 100 is out of 262 total. So they're not taking the entire population of hospitals and affixing to those who are the top 50, top 100. So that's one of the rankings, Health Grades. Another one is Consumer Reports, which does what you would expect Consumer Reports to do. So they're very much about the consumer experience, whereas Health Grades is more about, well, we'd like you to do some internal improvement, enlist us as a consultancy perhaps, to improve your internal hospital operations, whereas Consumer Reports is much more interested in how their subscribers, so they have a subscription model, so to get access to their rankings, you have to subscribe to Consumer Reports, and they're looking at, hospital quality from the perspective of the consumer. And one thing that's interesting that they do, that the other rankings do not, which leads to some of the observed variation, is Consumer Reports actually ranks what's called HCAHPS, which is a measure of the patient experience. They're the only one of these rankings that incorporates that into their data, and that leads to some differences with their ranking versus the others. Leapfrog, as I mentioned, so full disclosure here, I am part of the expert panel that advises Leapfrog in terms of what should comprise their safety score. I don't have any other formal connection with Leapfrog, but I have given my input into what I think are good publicly available measures that indicate whether a hospital is more or less safe. So it's a pretty big composite of safety scores. And the condition for Leapfrog is it all has to be publicly available. And they put out hospitalsafetyscore.org, I believe. You can look up any hospital in the country and see what their safety score is, and you can also see what the dimensions are that are comprising it and those kind of things. So Leapfrog's doing that with an emphasis, again, on consumers, but they also report this data back to the hospitals and with hopes that they will use it for kind of internal improvement. So there's this kind of score, and then Leapfrog as an organization, independent of the expert panel, assigns a letter grade. So they grade people on A through F. One thing that's interesting is Cleveland Clinic's had some problems recently and some kind of high-profile things go wrong. The Leapfrog score actually predicted that in some ways because they were much lower than their reputations. They were getting D's and C's on that hospital safety score when most people would think of them as kind of an A-level organization. So these safety problems were evident if you look closely at the data. The other thing that Leapfrog will do is, people can advertise their grade on the safety score, and Leapfrog charges for that. Leapfrog also does their own survey and assessment for which they receive money to do that too. So that's part of their model as well. And that contrasts with Consumer Reports, which doesn't allow anybody to advertise their rankings at all. It's purely subscribers. That's how they're funded. And then lastly is U.S. News and World Report, which focuses a lot on specialties and whether you have a top specialty in neurology or something like that. And they, of course, charge whether you are a top hospital. So you might see when you go by a hospital these big, huge banners on the side of the building. Well, that's somehow how they make their money. And obviously, they sell magazines based off of their rankings. There was no organization that was rated top across all four. So that's pretty alarming because one would like to believe that quality is quality. And if you, and granted, even though these things are measuring slightly different versions, that if you're tapping underlying quality, you should be able to pick out some and identify some hospitals consistently across. And we don't find evidence of that actually. So that was intriguing in and of itself. And like I said, part of it is this kind of this structural differences in what people are measuring, but some of it also is, that every hospital can improve quite substantially on a number of measures. It's a good question. There's certainly not a single indicator of it. Otherwise, we would get more consistency and more people would measure that indicator. It's tough because hospitals are complex organizations. There are many different outcomes one can measure, and there's huge variation across those different because you could just say, well, measure outcomes like mortality. Well, is that really the best indicator of underlying quality? It's an important one, but is it the only one? Is it the best one? And so after doing this work, I would have told you going into it that, yeah, quality is quality, and there is a true underlying quality, and we should be able to detect it. And yeah, even though these ratings measure different things, we would expect to see more overlap. We actually observe very little. So maybe I think the most important thing is when ratings are produced, we need to be more careful about the languaging, right? If you're saying best hospitals, that's too vague, right? Because people might think they're getting really safe, high-quality care where they might not be, right? Because these things are measuring pretty particular things. And some of the things, like, for example, that U.S. News measures are pretty structural features of the organization. Do they have a trauma center? And that indicates whether they're best or not. That's not obviously a perfect indicator of the quality of care. Yes, they might have the presence of that, but how good is it? Do we know? I don't know. So we need more fine-grained measures of those kind of things. So what I think is important is that we know and have some real clarity and transparency about what each of these things are actually measuring. So when people consult them, they're making informed choices. So, no, there's not going to be any one perfect measure of indicator of quality from a single measure, and even an index, because you would have to have so many elements that it's going to be difficult to unpack what that means. So if you have 100 different data elements comprising your rating of a hospital, what does it really tell you? Well, if I'm going in for a specific procedure, not much. Maybe this hospital is kind of good in general, but I don't know if they're good in what I need, right? So I think just more clarity about what these ratings are actually doing so people can consult them when they need to know specific information.